We've had Langley, Comox, and Burnaby that Brittany was making happen there.
Seashell.
Some challenges, and it's partly because we've been having such success in this province, pushing this forward, opening up dispensaries, helping patients, that we're seeing some of this blowback. And we should be proud of the work we've been doing, but just to keep in mind that it is part of a movement, part of a much greater thing that goes far beyond this room. It goes all across this province and all across this country, and we are making huge and tremendous progress and able to help thousands and thousands of people get this medicine and haven't been able to get it. And so what's happening here, and the support that we're seeing, and hopefully the rebirth of this dispensary, I think, will be important not only for Langley, but for other communities that are also struggling with this, and that are also trying to decide what to do, because we're all inspiring each other, and we're all working together to make this kind of change happen. And I also want to pledge from our dispensary that to tell Randy that if someone else is moving forward and opening a dispensary, that we'd be happy to help to provide some medicine and some other supplies to get that place open. We're making history and we're making change so that our children and future generations don't have to fight this battle, because we're fighting it now and we're going to get it done now. And that these raids and challenges are really a sign of our great success. And that's all I wanted to say.
Question for you, sir. Is there a contact website that's central that can get everybody on the same page so that we can organize and get across this country and get updated on what's happening, what we can do as individual members against this oppression?
Yeah, well, there's a few different things that are going on. There's an organization, a national organization of dispensary operators that's been formed called the Canadian Association of Medical Cannabis Dispensaries. It's still kind of a new organization. We've really only been forming in the last couple of months. But the idea is to create a national organization that can lobby for dispensaries at the national level, that can help us certify dispensaries, so we have some kind of standards that we encourage everyone to follow, and that kind of thing. And I've been thinking, and probably the time has come very much so right now, to create a provincial organization as well. And I think ultimately what we seek, or what I think is a solution to this problem, is that dispensaries should be regulated provincially. It's a healthcare issue. Healthcare is provincial jurisdiction, it's not federal jurisdiction. And so much like what's happened with the Insight case, where Insight started out as kind of a federal program, it showed they failed, the federal government wants to stop it, the province has said, no, this is a healthcare issue, and our healthcare power in this case overrules your criminal power. And I think the same thing should apply to dispensaries, and we want to see the province of British Columbia and other provinces stand up and ask for that. And the provincial governments are not anywhere near doing that right now, but I think that creating this kind of provincial regulation and protection is what we really need. And so along with the other things that we're doing municipally to pressure Langley, I think putting pressure on the BC Liberal government to protect and regulate dispensaries provincially, and to CC those emails and those messages to the NDP as well, I think would be a good step for us to do. It's not the only thing we should be doing, but ultimately we want the provincial government to stand up for us, to protect dispensaries. You know, we know they solve a lot of problems, they benefit their communities, and we would be happy to have some kind of reasonable regulation and control placed on us if that meant that we could operate openly and legally. And so I think that's where we have to go. But right now, those have kind of still being formed. There isn't any national organization of patients or anything like that. I think that will be a bit trickier, but that will be a good thing to have. And certainly, you know, Health Canada's in the middle of making these changes to their program. I know they're acting in good faith. I'm not sure, do people still have time to get back to Health Canada on that? That's done, right? Okay, that's close. We're going to be seeing Health Canada coming up with their new regulations, maybe some improvements, I don't know, but ultimately they're really just trying to create regulations so they can stop dispensaries from existing and trying to get some kind of constitutionally acceptable program that still doesn't really work but will satisfy the courts and put dispensaries out of business. That's what Health Canada, I think, is trying to do right now, right? And so I know they're acting in good faith, and we have to keep opening dispensaries and keep pushing forward in this way. But certainly, if there was some kind of national patients advocacy group, that would be a good thing. But nothing like that exists right now.
Thank you.